Imagine a drug once hailed as a miracle for pregnant women, only to unleash a lifetime of suffering on generations. That's the heart-wrenching reality of the DES scandal. But here's where it gets controversial. Was this just an oversight, or a glaring failure of medical oversight that demands accountability? Dive in as we unpack this explosive story, and prepare to question everything you thought you knew about pharmaceutical history. There's growing momentum for an official public investigation into the pregnancy medication DES, following an extensive one-year probe by ITV News that uncovered the massive extent of this healthcare catastrophe. Social affairs correspondent Sarah Cocker brings us the details, revealing how hundreds of women impacted by this now prohibited substance, often called the hidden thalidomide, are uniting under the banner of DES Justice UK to push for a full inquiry and financial reparations. Their campaign gained significant traction after ITV News shed light on how health authorities failed to heed early warnings about the drug's dangerous repercussions. DES, short for stilbestrol and also known as diethylstilbestrol, is a man-made estrogen created in the UK back in 1939. It was widely distributed through the NHS to roughly 300,000 women from the 1930s to the 1980s, primarily to address concerns like recurrent miscarriages. Tragically, it wasn't until later that strong connections emerged between the drug and serious health issues, such as rare forms of cancer and reproductive problems in the offspring. And this is the part most people miss. The risks didn't stop with the mothers, they cascaded down to their daughters and even granddaughters, creating a multi-generational nightmare. Over 300 affected individuals have joined forces through DES Justice UK, inspired by ITV News' in-depth reporting that brought to light the systemic shortcomings in responding to the drug's alarming side effects. In a pivotal move, Health Secretary Wes Streeting has directed NHS England to collaborate immediately with local cancer networks, ensuring that general practitioners are fully informed about DES's effects and that women who might need extra checkups aren't overlooked. This could mean the difference between early detection and preventable tragedies for those at higher risk. Take Mary Stewart, now 83, who in 1966 received DES pills from doctors in Newcastle after enduring several miscarriages. Her daughter, Helen Scanlon, turned 58 last year, but the toll of the drug became evident when Helen was just a teenager. Doctors gradually pieced together the damage. Today, Mary lives with profound regret, telling ITV News she carries guilt for ever taking those tablets while pregnant with Helen, who has battled lifelong health challenges. From age 14, Helen endured severe pain that worsened over time. In her 20s, she learned of her abnormally shaped uterus and later faced cervical cancer. The agony became unbearable, leading us to decide on a complete hysterectomy to eliminate the threats and uncertainties, she shared with ITV News. Even more than 20 years on, the pain persists. What's next worries me, especially with menopause on the horizon, as doctors warn that could trigger more issues. I'm heartbroken over not having my own children, my sisters have families, and while I'm blessed with a wonderful stepdaughter, the sense of loss is immense. Mary, reflecting on her daughter's struggles, expressed deep sorrow. She went through so much, and it devastated me. For over 50 years, I've grappled with the idea that I caused Helen's suffering. I wasn't aware of the dangers. I trusted the doctors who said it would help me carry the baby. I followed their guidance and have regretted it ever since. Though time can't be rewound, I must cope with the consequences. Women who suspect DES exposure are opening up about potential health links, sharing their narratives firsthand. If this resonates with you or someone you know, or if you have a story to tell, reach out via email to socialaffairs@itv.com. We're listening. Claire Fletcher, a partner at Browdy Jackson Cantor representing UK DES victims, emphasizes the urgency. The government must own up to past errors and establish a formal public inquiry to examine how this tragedy unfolded. It's an utter shame that survivors have been dismissed, doubted, and embarrassed when all they sought was justice. They deserve transparency and rightful compensation without delay. Fletcher describes this as a monumental regulatory breakdown at the top levels, underscoring the need for accountability. To grasp DES better for beginners, it's a synthetic estrogen that mimics the body's natural hormones. Studies indicate that mothers who took it during pregnancy face about a 30% elevated chance of breast cancer. Their daughters, referred to as DES daughters because of in utero exposure, are more prone to a specific rare vaginal and cervical cancer called clear cell adenocarcinoma, which standard screenings often miss. Some experts, like consultant gynecologist Dr. Wael Aga, are advocating for updated guidelines to include yearly checkups and specialized tests for these women. Regular screenings catch the usual cancers, Dr. Aga explained to ITV News, but DES-exposed individuals need more vigilant monitoring to detect this uncommon type, potentially saving lives through early intervention. Members of DES Justice UK gathered in the Houses of Parliament in Westminster last Tuesday to launch their group formally and connect with around 37 MPs pressing for governmental action. This event was organised by Labour MP Jessica Toll, who was moved by her constituent Jen Hall's account featured on ITV News. Jen, 75, from Bournemouth West, believes her mother Rita received DES during 3 pregnancies, contributing to Rita's death from breast cancer at 32 in 1951, leaving Jen a young child. MP Toll calls DES possibly the largest drug-related scandal in Britain's medical history. Women from all over the UK, mothers, daughters, even granddaughters, came to Parliament today, she recounted. Their desires vary, some seek apologies, others financial redress for their hardships. But the overriding plea is for recognition and education within the NHS. Shockingly, there's no dedicated page on the NHS website explaining DES. Sharon Hodgson, Labour MP for Washington and Gateshead South and a champion for victims of similar medical mishaps, stresses the critical need for GP training on DES. Too often, when affected women visit their doctors to understand their symptoms, the professionals are clueless about DES or its harms. They're even searching ITV News articles online for info. This pattern repeats with issues like vaginal mesh, valproate, and primodose. We need improved professional training so that when these crises arise, patients don't have to teach their doctors. Campaigners are advocating for more than just an inquiry. They want widespread awareness drives for healthcare providers, ongoing studies into the drug's long-term family impacts, specialized cancer and fertility screenings, and a dedicated fund for compensation. And here's where it gets truly eye-opening. Our investigation revealed that the medicines regulator, MHRA, deceived the public for up to 25 years about when DES was discontinued, apologizing just last month. The MHRA wrongly stated that physicians were told to halt its use for premenopausal women in 1973, but it wasn't stopped for pregnant women until the 1980s, over a decade after cancer risks were identified. This admission raises questions: how could such misinformation persist, and what does it say about trust in regulatory bodies? A spokesperson for the Department of Health and Social Care acknowledged the pain. We hear the devastating stories of damage from the historical use of diethylstilbestrol, DES, where risks have lingered across generations, leaving some women feeling unheard and unsupported. The Secretary of State is seriously examining this enduring problem and exploring further government steps to aid impacted women and their families. Consequently, he's instructed NHS England to swiftly partner with local cancer alliances to educate GPs on DES follow-up protocols, ensuring no one misses out on beneficial extra screenings. For more details or assistance on these topics, check these resources: information on diethylstilbestrol, DES, exposure and cancer from cancer.gov, the campaign page by Brodie Jackson Cantor for DES-affected individuals, NHS info on cervical cancer and breast cancer, and if you need immediate medical help, contact your GP, use the 111 online service, or dial 999 in emergencies. Again, If this affects you or you have insights to share,